Welcome, everyone, to another episode of the Health Made Simple Show. I'm your host, Dr. Bart. This is episode number 267. Today, I'm going to share with you some clinical insights. If you haven't heard our clinical insights before, this is an episode where I'm going to share with you very specific insights that I have while I'm in clinic that I think would be shareable, that I think would be informative for all of us. These aren't just the magical cases, but these are the cases that we see as practitioners on a regular basis that I think if you hear and understand how my mind works behind each one of these cases can be beneficial to you for the long haul of your overall health. And again, anytime we're talking about health, folks, there's just a constant reminder, and the whole purpose of the Health Made Simple show is that health is simple. I'm not saying that it's easy. I am saying that it's simple. And the reason that it is simple is because our Creator created us in the eyes of perfection. And we have all the tools that we're ever going to need to heal from the inside out. And really what that puts on us is a responsibility to stop the interference, to stop interfering with the way that our bodies are designed to work. So maybe it's reducing the amount of drugs or alcohol that comes into the body, the amount of poisons that comes into our body, and being hyper aware of the other poisons that might be coming in that are not voluntary, to make sure to do the best that we can with our mindset, to allow ourselves to have thoughts that radiate and vibrate in such a way that our cells are open, they're not closed down, they're not being inhibited in any such way that would interfere with the transmission of nutrients, the transmission of nerve input through the course of the body. So again, health is simple. How do I know that? Because we were designed to be healthy and healing always takes place from above down and from the inside out. Now, with that being said, let's dive in. I'm going to give you 3 clinical insights today. One, I'm going to talk about a situation where I had a client who essentially thought they were taking too many supplements, and what they did about it, they essentially stopped. I'll go into that. The second one is going to be about if you're on a GLP, if you're on one of these weight loss drugs, whether it be Ozempic, tirzepatide, Mounjaro, it doesn't matter which one. A couple things we got to watch out for, especially the amount of muscle mass that we may or may not be losing. I'll go into those details. What are the specific numbers relative to weight loss and fat loss? I'm sorry, weight loss and muscle mass loss. And then last but not least, when we talk about a common situation, a sprained ankle, and that can be applied to anything, sprained ankle, wrist, joint, anything may be, what we want to do and what we don't want to do, but it's often the most practiced application when it comes to sprains and strains out there. All right, if you do hear a little banging in the background, it's because I'm outside today. There seems to be some construction all around, but that nonetheless, it's a beautiful day out, so I decided to shoot out here. And if you are watching this live, or if you're just watching this instead of just listening to this, you can see in the background a bunch of our plants and basically my backyard and my grill and whatnot. All right. Well, thanks again for being here. Keep doing the thing. Keep sharing out. Keep spreading the love. All right. First clinical insight I want to talk to you about is I was having a virtual consult, which is a big part of my practice. Probably over 50% of my practice is virtual. And this is one of those appointments where we sit down on a Zoom. I've got clients all over the country. This particular lady, entrepreneur, they have their doctor's office. They're building their clinic, etc. They're they're growing their practice. A lot of moving parts. So as a practitioner, you're a business owner, you're the creator, you're the practitioner. You got a lot of different things going on. So in this scenario, we've been working on some protocols. We're really moving our health in a positive direction. Everything really going good. Cholesterol, lipid panels look fantastic. Energy coming back. Working out 3 days a week again. All of these things coming true. Gallbladder situations cleaning up, and this particular visit, and we usually meet on a quarterly basis with this individual about every 90 days. And she says, "You know what? I just couldn't do it anymore. I just stopped all of my supplements." I said, "Okay, tell me more." And she says, "Well, I've been under so much stress lately. Everything's going pretty good, so I just stopped." And I asked her to elaborate a little bit on her stress, and she said, "Yeah, we're building a house, and we have all these different timelines and deadlines and all these decisions to make, and I'm overwhelmed. I get out of work. I have more things to do when I get out of work, and the idea of taking all of those supplements was just too much, so I just stopped doing them all." So I said, "All right, listen, I get it. Life is very busy. Life is never going to stop being very busy. But I want to talk, and I moved this conversation into a conversation that I think all of us have to have, and it is, what is your invisible ceiling? Where is it that you tap out, even though you might be doing really good things for yourself, that you tap out because that's where your capacity is just stuck?" In her particular situation, that was it. So first, I mapped out and said, is it really the supplements? And this is very important because we went through all the other things. Is your gallbladder working better? Is the fatty liver gone away? Yes. Are you working out now? Good. Are you feeling strong? stronger now today than you have in the last 5 years? And have we been using a lot of supplements? We absolutely have. I'm talking about like a small dump truck. And listen, when you have labs and you have histories and you have ongoing actions that you're taking, sometimes you take a lot of vitamins, herbs, and supplements. You don't, I'm not even gonna say you don't have to. It's just a matter of where you want to go. And I want to make something crystal clear too, and I'll kind of share with where the turnaround went with this young lady. I say young lady, she's probably 68. This is a very important conversation. We're supplementing all the time. Supplementing allows us to get where we want to go faster than we're currently going there. And sometimes it helps us overcome issues that might be going on. We might be overcoming blood pressure or whatever it may be. But supplements, if we're talking about vitamins, minerals, and herbs, they allow us to get where we want to go faster. Hopefully, we're being very specific and we're pinpointing the exact ones that we need to be having. And that's why I am an advocate of lab testing. We can see exactly what's high, what's low. We can look at functional patterns and look at overall just function of the human being and to see how and what we do need moving forward. With that being said, there's a lot of other things that we supplement. So let's not make any mistakes here. Exercise, folks, is a supplement. The idea of just going into a weight room in your backyard lifting up weights, there's nothing normal about that. That is supplementing a lifestyle that has created fragility, that's created weak human beings. So we're supplementing this inactivity with things like lifting weights. There's nothing normal about it. We're the only creature, only species on the face of this earth that goes for a run to exercise, that lifts weights to exercise. We are supplementing for the other parts of our life that are basically deficient. So the more that we sit in these desks, these chairs, and the longer that we do it, we become deficient in muscles. So we supplement with exercise. Your vitamins and your herbs and your nutrients, whatever you're taking, those are supplements to help compensate for the deficiency that you have, but also to help you move where you want to go faster. So with that, and then we broke it down to another level. So some of you out there listening to this and say, yes, I am tapped out. I'm taking so many supplements. It's overwhelming at night. Well, in this scenario, for the most part, I only recommend whole food supplementation. Foods that it's easy. It's supplements that are essentially like food. So in this scenario, this lady was taking 46 tablets per day. I don't think that's a high number. I think it's a high number if you're starting at zero, but there's a lot of you out there taking more than that. So it's about 23 in the morning, 23 in the afternoon. And again, very specific reason for each one of those. Not just because we saw a good Instagram, post or something like that and decided, well, I'm going to order this one as well. And I know we all kind of do that, but those aren't the ones I'm talking about. I'm talking about very specific to your particular needs. And folks, it's very easy to get to that number. If you're no longer 20, most of you aren't, and maybe you have some issues going on with your lipids, maybe a little bit of insulin resistance, maybe I don't know, a blood pressure issue, maybe having a little bit of sleeping challenges, maybe have a little bit of a gut issue. Right there, folks, that would easily cover 10, 20, 30, 40, 50 different supplements. That being said, this is what I broke it down to, and this is what I mean by the invisible ceiling. At the end of the day, her 46 supplements all added up would fit on 2 tablespoons. That's it. 2 tablespoons, 1 tablespoon in the morning and 1 tablespoon in the evening. And that's it. That's what it boils down to. So is it really the supplements that are overwhelming? The answer is no. It means that she had met an invisible ceiling, meaning a lot of things going on in her life. And this is a time, folks, when we need to supplement more. We need to supplement more naps for sleeping, for rest. We need to supplement more adrenal support, whatever it may be, because our invisible ceiling is where we crash, and for some reason we can't get out of our own way and break through that. I promise you this. If you're thinking that somewhere down the line, life is going to get a little bit less complicated, a little less, it's going to become easier, you're not going to have as much stress, I'll pray for you. I pray that happens for you. But myself and many of you listening to that know that it does not. So as a result of that, figuring out how to add to and increase our capacity so we can handle more things. And really, what does that mean? It means a supplementing in life so we can handle more of these things, this crazy thing we call life. Life, the new level of life that most of us are living, there's nothing normal about it. Not at all. We've just normalized being under constant levels of stress and all of these, some burdens that we take on, but a lot of these things we choose to take on, and they're very, very consuming for us. And our answer to that is to supplement more exercise, more mindfulness, more breathing, more naps, more meditation to balance out, and so we could have more capacity to handle these things. So, all right, so that was clinical insight number one. If for some reason you're out there, you're taking a lot of supplements, first make sure that you and your practitioner, or you, whoever you're figuring out how and what you're taking, that you make sure the ones you're taking are very specific. We do this as a service in our office. If you have a bucket full of supplements, I'll often tell you, just bring them with you. Bring them to the next visit you're in, or bring them to a consult. Bring them to one of my clinicians on staff. We'll go through them with you. We'll see what you're overlapping, see what you do need or don't need, or find out, even if you understand why you're taking them. Everything you put in your body, you should have a general idea of why you're taking that. And if I've given you supplements before, I'll often ask you, and you know this, if you're one of my clients right now, I'll often ask you, do you know why you're taking this particular supplement? And if you say no, we're going to have a conversation about that, because the better you understand why you're doing it, the more likelihood you're going to do it. All right, let's move on here. So number 2 is this. Let's test, don't guess. So if you're out there right now and you are on a GLP, Ozempic, Mounjaro, Trizepatide, you're on one of these weight loss GLP-1s. We have a lot of clients, and that particular day, I had a couple of different clients, and they're on them. We have the conversations. I don't put people on those. I'm not adverse to it, but I am 100% very specifically encouraging people to manage 2 things. Weight loss, you have to manage this. To lose 10, 20, 30 pounds rapidly, your body's not prepared for this. Many different things are going to take place. If there's just one thing that's going to take place, your collagen can barely keep up with those losses. That's why we hear and see things, what's called Ozempic face, where your skin starts to drop. Even though your weight is dropping, your skin's looking worse. Essentially, you look older, even though you're losing weight. So with that being said, let's test, don't guess. If you're local, this applies to you. And maybe if you're not local, you can find a place. We have something called an in-body body composition tester in our office. So around the country, there's a lot of different ones that do the same thing. And really what we're able to measure, we measure your weight, your skeletal muscle mass, your body fat percentage, your visceral fat, left arm to right arm, water weight. We get to see all of the markers to find out how much weight you are losing and where is it coming from. If you're losing weight, there's a normal, let's just say, percentage of muscle mass that we expect you to lose. For about every 10 pounds, you lose about 10% of that may be muscle mass, preferably none. So it would be 1 pound, maybe up to 20%. So for 10 pounds of weight loss, 2 pounds of muscle mass would be the absolute max that you'd want to lose. And what I'm telling you right now, the reason I'm suggesting this, I'm using this as clinical insight, there are literally thousands of people, many of you right now are on these, and you have no idea how much of your body weight loss that you're losing, this weight loss that you're having, how much of it is muscle mass. And I'm telling you right now, we are discovering it's beyond 20%. That's not good, folks. Why is this not good? And yes, it's good to lose weight, but fragility is the worst thing that we can have as we age. There's nothing worse than fragility. That is the number one root cause of dying early, meaning this, you can't handle what's going on next. And we now know through a lot of different science and observations that, just for example, the number one predictor of surviving cancer at this point, the number one predictor is muscle mass. The more muscle you lose, the less likely it is that you're going to survive. And really, what does it mean? The more fragile you become, the more vulnerable you are in life. And so that is why fundamentally we want to know. And listen, there's no judgment. Hopefully you have providers, and I'll tell you right now, I'm never in judgment. If you're on them, so be it. Let's manage this properly. But I would also say, with this is a little side note here. So we're definitely going to test, don't guess. Go find a place. You can do it at my office, even if you're not a client of mine. This is a free service. Just walk in, kick your shoes off, get on the InBody scale, and in 2 minutes you're going to get a readout. Do it about every 30 days, and you'll be able to keep track. All right, with that being said, and that'll help you determine, okay, I'm not eating enough. I'm eating a little bit because I don't have an appetite anymore, but I'm certainly not eating enough protein. And that's where we see it, folks. Hands down, every single time, saying, well, I'm not eating, I'm just not hungry anymore. It doesn't mean you don't need the protein, folks. It doesn't mean that at all. If you're not eating the protein, you're not getting the collagen. And then we have problems there. So the second part of that I always say is this. When you lose that much weight that fast, your body wasn't prepared for it. Otherwise, it would have already participated in that weight loss, because most likely you've tried other things in the past and you've said, nothing's working for me. And part of it is because your body's not prepared. The detox pathways aren't prepared. Your skin, your collagen. Many of you out there are 40 plus years old. And if you think losing 10, 20, 30, 40 plus pounds that your skin is going to rebound, someone's lying to you. You have to very strategically understand the pace at which you lose that weight and what to do about things like collagen, your skin, your ability to get your skin to bounce back. And it's not just much as, oh, I'm just going to eat a little collagen in my coffee today or put a little powder in it. It's a little bit more than that. So let's make sure that we are testing. Do not guess. All right, last but not least here, let's talk about sprained ankles. So this was a situation where mom brought in her daughter. Her daughter sprained her ankle, and I see these all the time, so I wanted to make a note to this because this just reminded me that not everybody understands this process about inflammation. So really, this little clinical insight is about inflammation. We often hear that inflammation is the root of all evil. Now, that's not entirely true because there's really two components to inflammation, or two types of inflammation. You have inflammation that is generated from something like a sprained ankle, a trauma. You've damaged the tissue. And that inflammation is actually very important, folks. It is one of the beautiful healing process that we were given through our Creator. All healing takes place from above down, inside out. The mechanism is this. You sprain the ankle, you roll it. It damages the tissue. Immediately, that damaged tissue sends messages to your brain. And in that message, what's taking place, it swells up immediately to protect that joint, basically making it so you don't use it anymore. It's increased its pain receptors excitement. So now everything is fired up. Everything is super sensitive. And it's doing that to protect you, to keep you from trying to walk on that ankle. And now all of that swelling is also messaging, going back and forth to the brain, telling your brain exactly what nutrients you need to heal the soft tissue, the muscles, the tendons, the ligaments, maybe even the bone. And you need those messages to make sure that your body is getting those nutrients. And the swelling will sustain itself as long as it is needed to do so. And again, this is the part where you'll hear me often talk about how health is simple. We have to get out of the way. Interfering with the swelling that takes place around a damaged joint is getting in the way. When we reduce that inflammation, this part of my point here, and again, I'm not giving you any medical advice, but I'd be very cautious in using an anti-inflammatory when you sprain your ankle, when you sprain your wrist, when you have a trauma, an athletic injury, because the anti-inflammatory inhibits the message between your brain and your body, so it does not send the nutrients and it does not support the joint. In fact, it kind of fakes you out and says, you're fine, keep doing what you're doing. And folks, we're smarter than that. I know we've been led down the road that inflammation is categorized as inflammation is bad, but that type of inflammation is actually very good for us. We even have to be very mindful about icing just to reduce the inflammation. Have I recommended ice? Yes, but it's more for pain modulation than it is for just inflammation in the joint itself. Now let me shift gears and talk about other inflammation that is not good for us. That's what we call systemic inflammation. This systemic inflammation is usually driven by putting poor foods in our body, putting poisons, putting alcohol, putting sugar, putting processed foods, putting all of these processes, these processed foods, the bags, the chips, the muffins, pastas, all of that kind of stuff, the foods that shouldn't be in our body to begin with, they create systemic inflammation. That's the inflammation that affects the brain function. That's the inflammation that affects the arteries. That's the inflammation that ends up creating more plaquing in the arteries. That's the inflammation that affects the heart. That's the inflammation that affects the joints systemically. Arthritis, rheumatoid arthritis. That systemic inflammation, sure, bad guy, no good. We don't want that one. But we're not taking anti-inflammatory drugs for that because that's not the root cause. We're getting to the root cause for that inflammation through diet and lifestyle. That's how we have to address that. The acute inflammation that we're experiencing every now and then in this situation, a rolled ankle, we want to be very careful by using some of the most common things that are used every day, which is anti-inflammatory meds. And I'm not giving you medical advice. I'm telling you, just be mindful. Listen to what your body is trying to do. The power that made the body helps heal the body. And it's our job to provide it what it needs to heal and get out of the way. If we interfere by telling the brain and the body to disconnect so they no longer can communicate through pain medications, through anti-inflammatory medications, interfering with the natural process that is taking place, which your body is trying to heal you. That's the swelling, folks. It's a healing component of the body. And I know it's not the way that we're traditionally trained to learn it this way. We're thinking, oh, it's I rolled my ankle, it's swelled up, I got to ice it down. Hey, listen, if you use a little bit of ice for pain modulation, meaning to calm the pain down a little bit, slow things down a little bit, just calm the area down, fine. But icing it all night long, no. That same thing is going to inhibit the amount of blood flow. So we want that natural blood flow to be there. That blood flow is what's going to carry the blood, the nutrients, the oxygen, the hormones, all the healing agents is coming through that blood. And if we're icing it down, we're slowing down the blood flow. So in this scenario with the young girl, I made some suggestions and recommendations. At least be mindful of the anti-inflammatory drugs, the pain medicines, and of course, we had a real conversation. Well, she's so uncomfortable. Don't you think I should just give her a little, Advil or, heaven forbid, Tylenol? Yeah, we'll cover that in the next podcast. Should we give her a little bit? I said no. Here's the deal, especially with her foot and her ankle. If she doesn't move it, if she does not walk on it, she'll have no pain. And again, here's back to the same scenario. The power that made the body heals the body, as long as we don't interfere. But if our stubbornness, our impatience with the way that the body is designed shines through, and we have to use our ankle or have to use and every time we step on it, it hurts, and you have to make that pain go away because you're just so stubborn that you have to use your foot to step on it, then sure, interfere with it. But you will pay dividends down the road. What is the dividend? Typically, for those who've been practicing long enough, you know what happens. You increase scar tissue to that area. You increase sensitivity and the potential of that injury to happen again, folks. That's what happens. There's no shortcutting this. You always pay down the road. So with that being said, if you do sprain a joint, step back and understand that, and listen, your body knows how to heal this with or without you. Your best thing you could possibly do is live your best life in that moment. Get a ton of rest. You heal when you rest. Most likely, calm it down with that joint. If it hurts to move, don't move it in that moment. There'll be a time when you can slowly move through some pain. Of course, there's going to be some discomfort on your rehabbing of it. Try not to interfere. When we interfere, we then have to pay back later. And sometimes our interference takes a long, long time to pay back those dividends. All right, folks, that being said, these are some clinical insights. Hopefully you found them helpful in some way. If not for you, maybe you can share them out to a friend, a family member, or someone else you know that might benefit from these clinical insights. Keep doing the thing, keep sharing out, keep spreading the love, and of course, continue to level up and taking care of your mind, your body, your overall wellness. That'll be awesome.